Hey, Michael. Yeah, she's gonna try again. I guess with the Zoom link that that you guys had shared.
Okay, so why don't we get started and why don't we get
we should get
started, and if she joins, we will add.
Yeah.
She's able to join, but I don't want to hold this up much longer since we're already 10 minutes into our hour. So, all right, so welcome everybody to our town hall on workers' rights. We are very excited to have Lorelei Salas with us, the Commissioner of Department of Consumer and Worker Protections, as well as our two council members for Community Board 3, Margaret Chin and Carlina Rivera. I'm going to quickly just explain to people how to get into the interpretation for the event, and then our Mandarin interpreter will repeat that, and then we will start the interpretation room. Right now, our Spanish interpreter is having some technical difficulties. So if you need Mandarin interpretation, you just go down to the bottom where the toolbar is and click on the globe icon and select Chinese for the Mandarin interpretation, and then you will hear the rest of the town hall in Mandarin.
现在呢，我们的会议即将开始。我们现在呢，所有的嘉宾也都到场了，但是现在由于我们的西班牙文的翻译呢，有一些技术性的问题，无法加入我们的这次会议。那呢，我们现在呢，希望可以帮助大家所有需要中文翻译的人呢，找到他们中文翻译的频道。那你请看一下您。Zoom 的下方有一个工具栏，工具栏上有一个地球仪的标识。那地球仪的标识，你请点击一下地球仪标识，找到中文，来加入我们的实时翻译的语音频道，让我们可以为您翻译。谢谢。
Okay, interpretation rooms have been turned on. We'll give people a minute to get into their rooms. So while people are getting into their rooms, my name is Michael Marino. I'm the first vice chair of Community Board 3. I'll be moderating some of the discussion tonight. We have about a dozen or so questions that were sent in advance. But if you have a question for the commissioner, please use the Q&A feature or the chat feature. She's got some of her staff on the town hall tonight as well that can be fielding some questions in the chat as needed. But we're going to start with some opening remarks from our two council members. So we'll start with Council Member Chin.
Thank you, Michael. I'm really impressed with the translation service. And I wanted to thank Commissioner Salas, my fellow council member, Carlina Rivera, and Manhattan Board 3 for partnering with my office to hold this educational town hall. As our city continued to reopen, this town hall is occurring at a perfect time. You know, just last week, the council passed legislation to officially change the Department of Consumer Affairs name to Department of Consumer and Worker Protection. And with that comes a bigger mission. And in addition, the New York City Commission on Human Rights issued legal guidance on age discrimination. You know, the workplace is constantly changing, and age stereotypes affects all of us, whether it's being too old or too young for a job. But now COVID-19 has doubled the pressure on older workers to adapt to a new job expectation and economics reality. The new guidance outline do's and don'ts from the job posting and the hiring practice to discrimination in the workplace, all the way to retirement. For example, an employer cannot ask you how old you are during your interview. An employer cannot allow an environment where older workers or younger workers are singled out and passed over for opportunities because of their age. And an employer cannot force you to retire at a specific age unless it's legally mandated. So while this is a step in the right direction, there's still so much more work to be done. So no one should feel uncomfortable or threatened in their workplace because of who they are. Let's work together to make sure New Yorkers know what their rights are, and I look forward to hearing how the Department of Consumer and Worker Protection will be an ally to report any instance of discrimination and hold people accountable. And I wanted to thank everyone for being here today. Thanks.
Thank you, Margaret. And now we'll hear from our Councilmember Carlina Rivera.
Hey everyone, good evening. I just want to thank you, Michael, of course, and Community Board 3 and my colleague, Councilmember Chin, who I just can't wait to see in person sometime soon. And of course, Commissioner Salas, for all the work that you have done. You've been in my district multiple times, really trying to listen and reach out to people proactively, whether business owner or worker. So I'm just so glad that we can come together for this Know Your Rights Town Hall. I'm very, very excited to share and to also learn about all of the city resources we have to support New Yorkers and small businesses that are currently suffering. I know it's a very confusing time for every working New Yorker and those who are underemployed or even seeking some sort of supplemental income or employment. The future of the federal unemployment benefits is really, really uncertain. And the public health landscape feels like it changes every single day. And I also know that the current pandemic has hit some of my district's beloved mom and pop stores really, really hard. And it breaks my heart because we know that small businesses are the lifeblood of our communities. This pandemic has exacerbated existing inequalities, making it harder for part-time, immigrant, and day workers to find and maintain a source of income. And as we've seen, our undocumented New Yorkers have been left out of that type of assistance. I, along with my colleagues here today, am committed to fighting for the necessary protections for all New Yorkers, especially our essential workers and local businesses. We worked in the City Council to pass my bill on personal liability protections for small businesses, and we have pushed for legislation to be passed to give workers stronger rights during COVID-19. But there are also a number of tools out there right now that may help you at your place of employment or may help you find employment during this pandemic. So many of my constituents have questions, and I think they've submitted a couple of them about safely reopening and returning to work. So I hope that we can answer all of those questions today. Whether you are an essential or a non-essential worker, I know we all deserve the right to be safe in our workplaces and have a place to contact if our workplace isn't following the rules. So thank you all again for being here today, and I'm looking forward to an informative discussion.
Thank you, Councilmember Rivera. As I mentioned before, we have about a dozen or so questions that were submitted in advance that we will get to, but first it's my distinct honor to introduce Commissioner Salas, who will give us a brief overview about the Department of Consumer and Worker Protection. Commissioner?
Thank you so much. Good evening, everyone. Thank you, Michael and Council members Chin and Rivera for hosting this town hall. It is so very important for us to be bringing information into the hands of our communities when they need it most. And I really encourage the audience to ask questions and follow up. I have two members of my team joining today, Tanjila Rahman, who works on all the outreach for the office, and Ben Holt, who's the Deputy Commissioner for the Office of Labor Policy and Standards, and will help me to supplement some of the answers and or answer better than me in many cases. You know, they're here right now, but even after today, please reach out to us. I know that we're going to post our contact information because this is right now a process of continuing to have more and more information. Every day there are new things that are happening, and we want to make sure that our New York City residents are getting trusted information from the right sources. So I appreciate tonight's invitation. Couple of things about the agency, and yes, we have recently been officially renamed. Thank you to the council for naming us Department of Consumer and Worker Protection. As our name implies, we do enforce the laws in New York City that protect both consumers and workers. During this pandemic, we have seen a number of issues come up. with regards to consumers, and you probably have been aware of some of the price gouging issues we've seen in our communities. We want to make sure that the products that New Yorkers need to take care of themselves and prevent the disease are available to them at prices they can afford. So certainly we've done a lot of education about this issue, and also have published rules that make it illegal to increase prices for some of these products that, again, are meant to just make sure New Yorkers can stay healthy. We also know that at a time of need, it's usually the moment when some actors will take advantage of that, of our communities that are most vulnerable, and oftentimes take the opportunity to even deceive and trap some of our New Yorkers who really are hoping for any assistance they can get in order to survive this crisis. And so we encourage you to come to our office, or come to your council members' offices when you hear about issues happening in your communities. We want to stay vigilant. There are a lot of benefits right now from the state, the city, and the federal government. I will speak about some of them today. But one reminder to New Yorkers is that all of these benefits, government benefits, are available for free. No one should be charging you to make yourself, to avail yourself of some of these very important benefits. So in terms of worker protection, I would say that also, and I know that the focus today is about reopening and coming back to work in a safe manner, but all of the New York City workplace laws are in effect right now. We haven't stopped answering questions from both workers and businesses. I mean, certainly there's been a lot of interest from businesses in New York City to know what their obligations are and to do the right thing. So I echo the sentiment of Councilmember Rivera. A lot of people are trying really hard. And we also have workers who are nervous about coming back to work because they want to stay healthy and they don't want to infect their families, and they have a lot of questions. My office has published guidance for both workers and businesses in various languages, guidance that keeps getting updated as we continue to progress in the phases of reopening. So come and visit us on our website. We have materials in different languages. Another very important thing that I want to say about most of the laws that we enforce and the programs that we have and the services we offer are available to everyone, all New Yorkers, regardless of immigration status. That is very important. It is not a piece of information anyone in my office will ask for. It is not something that is necessary for any of our cases. If you call us with a complaint, we will never ask you that question. So we want you to trust that when you come to our office, we're going to try to help you, and that your information is safe with us. In addition to protecting workers and consumers, we have an Office of Financial Empowerment, and I'm going to mention a couple of things about this office because, again, we are experiencing a health crisis, a financial crisis, and it's the time when New Yorkers really are looking for every door they can open that will help them get through this difficult time. And so we have financial counselors across the city. Typically when before the pandemic, we had our services were provided in the 5 boroughs throughout. I would say the services were provided by community-based organizations housed in different boroughs. Right now, the services are being done over the phone and by video because of safety reasons, but we hope to soon be able to reopen in person. But today, you can get in touch with a financial counselor to talk about your finances, to talk about tackling your debt. Our counselors are trained to really know what the different type of relief is available to New Yorkers. with respect to student loan debt, with respect to even consumer debt. Our agency has some licensing authority of debt collection agencies, and we're working really hard to make sure that during this time, New Yorkers are not being burdened by phone calls and communications from debt collectors. So we encourage New Yorkers to call 311 and ask for a financial counselor who will be a trusted advisor to you in this time of need. And again, the only requisite for accessing financial counseling is you just have to be over the age of 18. And we have counselors who speak different languages. So I want to focus a little more on the worker protection piece because it is, it's so important right now that we are all working together to make sure that in New York, we continue to make progress in battling this disease. And we have a worker hotline. We've gotten over 3,000 phone calls to date from workers in the last month or so with questions about their rights. But many times workers are still expressing fear and anxiety about reporting a violation. And the truth is that we can keep workers' information anonymous. We don't have to tell anyone who called us, but it's so very important for us to get the information of those businesses that are not complying with the safety guidelines because it's not just the workers who are employed in the business, but it's everyone else around them that are going to be put at risk. So we do encourage people, whether it's the public or the workers or other businesses, to let us know when they see an issue of a business that's not complying. Really, the city has been putting a lot of resources into educating businesses and bringing them the tools they need to comply with these guidelines, which I understand it's a lot of information. There's a lot of requirements, but it is very important that we all work together on this. In the last 4 weeks, my team has been on the ground. We have done over 14 or 15 business education days in collaboration with some of the council members and the business improvement districts, bringing materials, the state guidelines in different languages, door to door to businesses that really are trying to do the best they can to protect themselves, protect their workers. Just last week, we were in Council Member Chin's district, and we saw really high level of compliance and street dining locations that look great. So we're really encouraged by that, and we want to remain positive, but we have to do it together. So that is my call to action, to please let us know if you see an issue. We will go out there and educate that business to make sure that, again, we all continue to reopen in a safe manner. And then just generally, we are all operating, all our services and programs are in place. The easiest way to reach us is to call 311. And I know that there are some more specific contact information for the Office of Labor Policy and Standards. And I believe that Tangela and Ben will be putting it in the chat for people to write it down. But as always, 311, we get all those calls, we get all the emails, and we are here for you. So I will leave it there because I know there are a lot of questions. So I'll hand it to you, Michael.
Thank you, Commissioner. And if you haven't noticed already, our Spanish interpreter has joined us. So if you need Spanish interpretation, you can just click on the global icon and choose Spanish. So Commissioner, we did get a slew of questions. A lot of them are related to people's concerns going back to work, rightfully so. So I'll start off with some of the ones related to that. What precautions and protections are my employer required to provide me?
So there are some general guidelines that apply to all industries, and there are some other more specific guidelines for certain types of jobs, like construction, like manufacturing. But in general, every business is supposed to first affirm to the state by going onto the state website to affirm that they understand what the guidelines are and that they will be complying with them, and then post a safety plan in the workplace that tells workers, employees, basically, what steps the employer is taking to ensure safety and health in the workplace. So a number of things that are the things that everyone already knows about, right? Face coverings or face masks, those are required to be provided to employees at no cost. So just like any other type of protective equipment, employers are not allowed to charge workers for those face coverings. The city has been making available face coverings for free to businesses. So if that is an issue, please reach out, and our colleagues from Small Business Services will be helping the businesses to make sure they have those face coverings for free. Social distancing is another very important requirement. So for most businesses that have reopened, and we are now on phase 4 of the reopening with some restrictions, you know, the most probably the one that is the most known is the fact that restaurants are still not allowed to do dining inside the location, right? But social distancing is very important, and so most workplaces will be limited to up to 50% capacity. So for instance, if a retail store was able to have 80 people inside, including workers, at any given time before the pandemic, now they're limited to 40, including workers. Employers are also supposed to be making hand cleaning, hand sanitation materials available to workers. So either workers should be allowed to wash their hands regularly or should have access to hand sanitizers, and they should be able to do that, to use them often. Employers are required to do a health exam, health intake every day before workers come back to work. Now, there's no specific requirement as to whether employers have to take employees' temperature or not, but there are some models, some guidelines that the Department of Health has published, and this is just to prevent workers from coming to work sick, right? So every day, and even us as an agency, we have to do the same thing. Employees who are scheduled to work must answer 3 or 4 questions that are designed to capture whether anyone has any symptoms. And employers have to keep a log of those records that they've asked those questions. It's a requirement to keep that every day. The business also must be doing cleaning and disinfecting of the workplace at least once a day, preferably after every shift. And if there are certain surfaces that are used commonly by more than one person, they need to be cleaned those regularly. Employers also have to keep track of that. So at any time, if a city or a state inspector visits the business to do an inspection, to check for compliance with the guidelines, they could be asking the business to show them those records, right? In certain cases, again, so another reminder is like, if employees are sick, obviously they must be sent home. And there are laws that require employers in New York City and in the country to pay workers for time they use to take care of themselves or their families. The paid sick leave laws are a very, very important benefits right now, life-saving benefits. And there are 3 different levels of benefits from the city, the state, and the federal government. And I can talk more in detail about it after. And then the other thing that I would say is that employees must also receive training on safety and hygiene protocols. So that they, you know, they again help, they're all protecting themselves, protecting their co-workers. I think those are the most general guidelines. There are certain like industry specific mandates, like for instance, with hair salons and other like personal care type of business. Basically, there are some limitations on services. If a particular service would require the customer to take their mask, their face covering off, that service is not allowed, right? So a man cannot have their, you know, their beard shaved if it requires the you know, if they have to take the face covering off, right? So depending on the industry, there may be more specific requirements. Yeah, I'll stop there.
Thank you, Commissioner. So on that, that theme of returning to work, can employers request test results or proof of antibody testing by the employee in order for them to return to work?
So employers can, there's nothing that prohibits them from requiring those tests, but employers cannot do that in a discriminatory manner, right? Employers cannot ask only certain class of workers to take the test. They cannot just go by race. They cannot say over a certain age, right? If you're asking employees to take the test, a COVID-19 test or an antibodies test, it must be a blanket policy that applies to all workers. Nothing requires an employer to mandate that. But what they are required to do is to do a health screening every day, as I mentioned earlier. So again, the employers are free to design the way in which they will check for these issues, but they have to do it in a way that doesn't discriminate against any employee.
Thank you. And what about, we got a couple of questions asking if an employer can ask employees to sign an indemnification waiver, so that if they do get sick on the job, they cannot sue their employer.
We've seen that happen. Look, whether it's a new issue, right? Whether that would be something that would hold up in court is yet to be seen. But a lot of the laws that are in place cannot be waived by a worker signing an agreement, right? If there are protections that are in place, they just cannot be waived by a worker. But I'll ask Ben if he has anything else to say about that.
No, I think you hit the main point, which is that legally we don't know what the impact of these kinds of waivers is going to be yet. I think we would encourage anyone who's being asked to sign one, if you have any opportunity to take the time and show it to someone else, an attorney, someone else to look at it with you before you do sign. But yeah, at this point, we just don't know how they're going to play out in the long run. But obviously, it's not a practice that we would encourage. I don't think that workers should be asked to waive any rights under these circumstances.
Okay. Commissioner, we're getting some questions about paid sick leave as well. So, you know, there's a couple of scenarios. So if an employee is sick, but they don't have enough paid sick days left to cover 14 days of quarantine, what do they do?
Yes, and so the New York City paid sick leave law, you know, thanks to the council, has been in place since 2014. And it's pretty broad in the way that it covers workers for different types of situations, right? It requires a minimum of up to 5 days a year for businesses that have 5 or more employees. And yes, 5 days may not always be enough, right? But these 5 days can be taken not just when someone is sick to take care of themselves or take care of the children. They can also be taken when there's a state of emergency that closes schools, for instance, and kids cannot go to school and parents need to stay home to take care of the kids. Now, as I mentioned earlier, there are state and federal laws that protect workers now who are sick because of COVID-19. Very importantly, since March, the state recognized that this is something that's really badly needed, and the federal government did too. They provide more, up to 14 days or up to 40 hours, I think up to 80 hours, maybe, right, Ben? Up to 80 hours. Now, it is not that easy to navigate the system because the benefit depends on the size of the employer and sometimes on how much money the business is earning in a year. So I encourage people to call us and tell us about their specific situation, because we would have to do an analysis of how big the employer is, how many employees in place, how much money the business is earning, before we can better advise. But in general, I would say right now, our state and federal governments have recognized how important it is to have paid sick leave benefits, and there are expanded rights. I would also say that under the Family Medical Leave Act, the FMLA, again, if the employer is covered by that law, workers could take up, I believe, up to 12 weeks of benefits at a reduced salary, but they could take that time if they need more time. So these are all different types of avenues that I think workers should be able to have enough coverage for the 14 days, depending on the law and depending on the size of their employer.
Can you talk maybe a little bit, there's some questions in the Q&A box from people who work as freelancers or gig workers. So how does paid sick leave affect them in relation to COVID?
So paid sick leave applies to employees, right? So individuals who are employees under the law. Okay, so there's got to be enough control by the employer. There has to be a relationship of employer and employee in place. An employee may be working part-time or on a temporary basis, and they're still covered by this law. The law currently does not apply to freelancers. So true independent contractors, true freelancers are not covered by this law. Now, oftentimes though, employers have misclassified employees. So we always encourage people to call us and to tell us the specifics of their situation, because just because someone is labeled a freelancer or was made to sign an independent contractor agreement is not what determines the status of the individual, right? We would decide if they were improperly misclassified and that they should be eligible for paid sick leave benefits. But a true freelancer, someone who's truly working for themselves and can control the terms of their work, wouldn't be covered by this law. There is currently a proposal, I think, before the City Council to provide more expanded benefits under paid sick leave that would cover some of these independent contractors, but that's still a proposal.
Thank you, Commissioner. What about childcare? So people, obviously there's a lot of talk in the news these days about what's happening with schools. Are they reopening or are they not reopening? What's the plan for students potentially doing a blended model of learning remotely some days and learning on site some days? So for workers who may not have childcare, or for whom childcare is an issue for them to return to work if their child is not in school, what resources are available to them?
So one of the, the benefits of our New York City paid sick leave law, again, is that it's very broad, and workers could use that leave to take care of their children if the schools are closed or they're partially closed. Now, it's not a lot of time, but I believe, and Ben, maybe you can help me supplement this. I believe that the CARES Act expanded one of the laws to provide additional benefits for parents who may need to stay home with their kids, right?
Yeah, so under the, first under the federal paid sick leave law, those 80 hours of leave that Commissioner Salas was describing, those are also available for care of a child. So you have the 40 hours under city law, the up to 80 hours under federal law, and then possibly the ability to get additional family medical leave under federal law. Similarly, the state paid sick leave law that went into effect in March also expands some of the uses for the state paid family leave law, which again might apply to some circumstances where you're caring for a child.
There's a number of questions that relate to reporting and confidentiality around that, and how if a worker feels unsafe at their job. There's one example in the Q&A. She works for a workplace that only has 7 people, 800 square feet office. the boss isn't even wearing masks, nobody's wearing masks. They feel very unsafe, but they also feel afraid that if they make an anonymous report, people are going to know it was them.
Yes. And look, there's no, I understand the anxiety about, you know, reporting your employer, right? People have just come back to work and they need the money, they need the jobs, but it's super, super important that we are made aware of those locations. Again, when we walk in to do some education or to do an inspection, we're not going to say that we're there in response to a complaint, right? We are going to go, and we're not just going to go to that business, we're going to go to the business next door and the other business, because this is, again, like I said, this is about all of us working together to make sure that we continue to be safe and healthy. So we need to know about that. She needs to obviously protect herself immediately, right? And make sure that she's wearing a face covering. But it is certainly not a good thing to be in a place, a very small workplace with other people who are not wearing face coverings. So we do need to know, and we can act, but we need the information. Otherwise, we won't be able to take action. There's so many businesses out there. We cannot possibly be everywhere. But she's doing it not just for herself. I mean, she needs to think that she's doing it for her coworkers and for her family and everyone else.
Somewhat related to that, there's a question in the Q&A and also one that came in email related to working from home. So if they don't feel safe at work, can they request to continue working from home?
So this is tricky because an employer can call you back, right? We have reopened. An employer can tell you that you need to come back to work. We are still asking, as a city, we have asked businesses to allow employees to continue to work from home when the job can be done from home. We also have said that occupancy rates cannot be at more than 50%, right? So the employers will still have, even if they call everyone back to work, they need to be doing it in a staggered manner, right? And have people who are doing both telecommuting and in the workplace. I mean, we cannot force an employer to establish a telecommuting policy right now, but we are encouraging it. So if they feel like this is the kind of business where they could be doing that, we can also talk to them, and you know, maybe there's some advocacy we can do also. But an employer can call you back to work, and if they are taking all the measures that the state guidelines require, then, you know, it should be safe to be going back to work.
This is also somewhat related to a question that we got from one of our constituents who's a UFT member for the past 23 years. They're in their mid-50s, and they were asking about reasonable accommodation due to the increased risk of severe illness from COVID. So I think they were saying, I didn't fact check this, so don't quote me on this, but they were saying that the CDC is saying that the risk for people in their 50s, they're at high risk for severe illness, not just people over 65. So can somebody use their reasonable accommodation rules to request working from home?
The employees certainly have a right to request a reasonable accommodation from their employers, and there are federal, state, city laws that require employers not to discriminate against employees who, and to be able to accommodate them as long as the job can be done and it's not a burden to the employer. Employers cannot do blanket policies that are just based on age, right? They would be in violation of the law if they actually said all workers over 50 cannot come into the office, right? They cannot do that either. But it is an individualized analysis. And if this person wants to, we can put them in touch with the Commission on Human Rights, where they can do a consultation to make sure that their situation is being addressed. And I know that Tangela just posted the phone number 212-416-0197. Again, you know, if a medical condition is considered, can be considered disability, so so that is something that will be taken into account. But employers cannot just make blanket policies based solely on age.
Okay, thank you. And I will say this is being recorded, so we will be posting this town hall on our YouTube channel probably tomorrow, and we will make sure to also download all of the resources that Tangela is putting in the chat file and make those available to people, so that if you don't have a pen and paper handy and on, you know, writing everything down that she's putting in there, we'll get it to you somehow. So Commissioner, we have a few more questions. We have about 10 minutes left, and Council members Rivera and Chin, if there's burning questions you guys want to ask that I haven't gotten to yet, just please feel free to interrupt me. The next question actually is very interesting to me because it actually pertains to me. What if, and it actually isn't really an issue right now because I think both New York City and most of the surrounding areas are at the same phase, but what if you live and work in areas that are at different phases? I work in Long Island, but I live on the Lower East Side. So, what rules do I follow?
Right, because the state guidelines are requirements that employers need to follow, right? So it is where you go to work that that basically governs whatever rules apply to your particular situation, right? As you know, New York City was behind in the reopening compared to some other places in the state, and so if you worked if you work on Long Island, then you need to make sure that whatever phase is Long Island on, which I'm sorry to say, I don't remember or know which phase they're on. That could be in the same phase we are, but anyway, that is the particular phase and the guidelines that rule. And when you go there, that is what you're subject to, right? So it goes by the place where you work, not where you live.
Okay, thank you. And speaking of phases, so what happens right now? We're at phase 4. What happens if the governor decides to roll us back a phase because of an increase in cases?
I don't even want to think about that. No, look, we are in a good place right now, right? Obviously, our state and city leaders are keeping a very close eye on all the numbers, on the infection rates, and trying to do their best to make sure that, again, as a city, we continue to support each other and continue to be safe. So right now, we are good. If the governor, for some reason, decided to roll back the reopening and certain businesses close, very likely those employees who have to go back home and cannot work would be able to apply for unemployment insurance benefits. And I mean, I think that's all I have. Ben, do you have something to add there?
No, I think we don't know what it would look like.
Yeah.
And, you know, similar to how things happened as we were closing down and then going through this gradual reopening, I think we could expect if there is a rolling back, there will probably be new specific guidelines that aren't necessarily the same ones we've been dealing with.
Mm-hmm.
Thank you. There's a question from somebody in the Q&A. Lisa's asking, as a customer, can she be charged a surcharge by the business for them having to provide PPE? So for instance, if she goes to the dentist or a nail salon, can they add a surcharge to her fees?
So right now there isn't, businesses are not allowed to charge a surcharge for, actually this applies, you know, I have to take back this question. This in the restaurant industry, businesses in New York City cannot charge a surcharge unless there is a let's say a situation where they're serving 6 or more people, or where customers are sharing one dish. It has to be a very specific situation. To be honest, I can't tell you right now. I don't want to give bad information, but if Lisa, I think you said, wants to talk to us, we'll make sure to give her the right answer. I'm blanking out on that right now.
No problem. And there's a follow-up from the question that we had about the from our UFT member. She's saying that the DOE is allowing employees over 65 to receive accommodations based on age. However, employees over 50 are required to have an underlying medical condition to receive accommodations.
Mm-hmm. Yes, I mean, like I said, that is a very, again, I mean, I'm not familiar with the DOE policy, but I can tell you that on my agency, for instance, it is an individualized, you know, request, an application, and it's reviewed by our human capital people, right? So I don't know the circumstances why they're differentiating there, but yeah, I don't have a better answer than that. Yeah.
And we have one more question in the Q&A. We might have covered this already, but they're asking what the legal policies are regarding employers who are only offering unpaid personal time off when you're sick with COVID.
So again, paid sick leave benefits are not optional, right? The employers are required to provide them if they are covered by the law. It is, again, the state and the federal laws are new developments, so a lot of people may not be very well aware of what their obligations are if they're employers. But an individual who's employed at a business in New York City can call us at 311. We will help determine what particular benefit applies to them, right? So it's not optional. If the employer is covered by the law, whether it's the city, the state, or the federal law, that employee has a right to get that, get paid for the time that they need to take care of themselves. There may be situations in which businesses, you know, say, if you need more time than that, I cannot pay you for that time, and you'll have to take the time unpaid, right? I know that at least under state law, some of the benefit is actually paid with disability benefits, which is a type of insurance that every business already has. So it's not even an increase in the cost at that point to the business. It's more of a benefit that it's already available because of the insurance. But Ben, I think, wants to say something.
I was just gonna add that for the city paid sick leave law, if your workplace has 5 or more employees, then it's paid under city law. And under the state emergency paid sick leave law, as long as there are more than 10 employees in the business, then there's some form of paid sick leave. But that's one of the other factors that as the commissioner was explaining, employer size and type of business, all things that we can help sort out if you give us a call.
Thank you. I have one last question that came in. We talked earlier about the self-reporting that employees have to do before they return to work as one of the requirements. So what if any, ramifications are there if, as an employee who's desperate to work, they falsify that self-certification because they just want to work?
Well, I would just say that you are putting everyone at risk, right? I understand that of course there's a lot of need, and I really empathize with that. I know that the city is trying to do what they can to make sure that everyone who needs food has access to that, right? There are some benefits that are available to mixed status families, so families that have both someone in their family who has immigration status to be in the country and others who don't may be able to apply for some benefits like food stamps and other type of financial relief from the city. But it is a difficult time, and I know that a lot of families who are immigrant families have been left out of all of the federal benefits. So I don't blame anyone for wanting to go back to work, but the truth is that you're putting everyone else at risk, and we just urge you to please stay home if you're sick.
Thank you. Thank you, Commissioner. We've blasted through a lot of questions in our hour. So I want to thank you again and your staff for taking the time to be with us tonight. Thank to our interpreters as well. Margaret and Carlina, do you want to say any last remarks before we sign off for the night?
Just thank you for everyone for participating. And thank you, Commissioner, and your team.
If anyone has any doubts or questions, please utilize the resources public health and safety is our #1 priority. And we want to make sure that everyone understands we're trying our best to do it responsibly and efficiently. And I know people want to go back to work. So thanks to all of you for bringing your voice and all of these tools to the public.
Awesome. Thanks again, everybody. We will be posting this, as I mentioned, on our YouTube channel and website tomorrow, and as well as all of the resources that Tangela has been listing in the chat. So for now, continue to be safe and wash your hands and practice social distancing and wearing your masks. And we'll see you all back at work sometime.
Yeah. Stay healthy, everyone. Take care.
Take care.
Thank you. Bye. Bye.